Yeah, hi, I'm Dr. Al Plechner.
Hi, Dr. Plechner. Can we talk a little bit about SARDS?
Well, SARDS is an autoimmune disease that causes blindness in dogs. And SARDS stand for sudden acquired retinal degeneration syndrome. The profession at this point seems not to have an answer for it, and what it is uh, the patient will all of a sudden become totally blind. It happened almost at any age. And the ophthalmologists that basically determine if this is SARDS or not they do right now an electroretrogram, which measures retinal functionality, if you will, and it's normally flatlined if it's a SARDS patient. And so the ophthalmologists at this time, veterinary ophthalmologists, have said there's no treatment, you need to go home and learn how to live with a blind dog. That's not true. I've treated several SARS patients very successfully. And if you look on the website, you'll see the testimonies. Dogs that were totally blind now are out chasing balls, jumping at butterflies, doing the whole thing. What SARS is and what is it not understood is it is an autoimmune disease. And it comes from a imbalance in cortisol. Whether it's deficient or very, very high, it's inactive. And it's caused by high levels of estrogen, which we've, I think discussed in other videos. And what that estrogen does is it deregulates the B and T lymphocytes so that they lose recognition of self-tissue. And what's been found is that there are no anti-antibodies, so the B cell is not producing something against retinal tissue, but the T lymphocyte is causing a cell-mediated toxicity. So it's attacking the retinal tissue, period. And the sooner that this can be discovered and be determined and proper therapy begun, the better the chances that we'll have some functional retinal tissue left. Oftentimes, by the times the healthcare professional decides whether it's Cushing's syndrome, which is active cortisone, which it is not, because if it were Cushing's syndrome and active cortisol, that's what they use to stop autoimmunity. And this is an autoimmune reaction. So it's simple to do the Plechner syndrome, which I think most of the SARDS people know about, which does the total estrogen, does the cortisol, T3, T4, IgA, IgM, and IgG. And these SARDS patients, because of the low-grade antibody production, it affects the eye. The IgA, mucous membranes of the eye, IgA, are low. Those in the gut are low. Therefore, right off the bat, giving oral medication, supplementation to get rid of the inactive cortisol and regulate the estrogen normally won't work because the IgA is below 58. And this is why depending on how low the IgA is, this is why a number of injections at a 10-day interval are indicated. And at that time, and thyroid hormone is used immediately because the estrogen will bind the receptor sites of thyroid anyway, even if it's normal. And so once the 2 to 3 shots have been given, at that time, repeat blood is done to see if we're at 58, so we can absorb oral, where we are, whether we need one more injection, or we can then, 10 days after the last injection, go to an oral steroid replacement. And once the endocrine immune imbalance is corrected, vision can come back if there is not permanent damage. The thing that's not realized is that the importance isn't even so much getting the vision back, but this is an autoimmune disease. And unless it's corrected, other autoimmune diseases and cancer will occur. So taking your dog home and learning to live with a blind dog is not the answer for your dog, period. Because you won't have to live with them very long with what's going on. So it's highly important to have any veterinarian that is treating a SARDS dog to realize it is an autoimmune disease. Doing the Plechner syndrome is the only way to fly on this, because otherwise they do send test results to the University of Tennessee, which does not do total estrogen. They do estradiol. They also don't do IgA. They do a wonderful job with what they do, and they're a marvelous lab, don't get me wrong. It's just that they're not doing some of the selective things we need to correct an imbalance that SARDS dog has.
And does SARS only affect dogs, or can it affect cats or other animals?
Well, at this point in time, I've only seen it in dogs. And I think I've probably worked with maybe 100 cases. And these are cases all over the world. I mean, this isn't just something here in California or here in the United States. I've worked with SARDS owners in England, in Scotland, in France, in South America, and South Africa, all over the world. So they're all seeing it. My concern, which the ophthalmologist, there's a thought, and I've run this by them, I worry about the monthly incept chemicals that are used. I've seen a number of cases where a heartworm medication was used, and 2 weeks after it was used, the patient became blind with SARDS. The ophthalmologists say no, they don't think it's involved. I'm concerned about it. I'm concerned in general with any insect repellent that's a chemical. And not to get off the subject, but if you read the small print, many of them will say if you touch this thing you're going to put on your dog, you need to call Poison Center immediately. So there are some alternatives that you can see on my website also. But anytime a SARDS dog is presented, whatever chemicals are being given for fleas, ticks, heartworm need to be stopped immediately, at least in my own opinion, which varies from other opinions. But the point of the issue is I do have dogs that have sight again. And so, yes, there is a treatment. Yes, there's a reason why they have SARDS.